Hello and welcome to Filling the Sink, a podcast from Catalan News. My name is Beth Cohen and today we'll be talking about the Covid-19 pandemic 5 years on. On March the 14th, 2020, Spain declared a state of alarm in the face of the coronavirus health crisis, placing the nation in lockdown and ordering the population to stay at home. 5 years later, we look back on the pandemic and analyse the long-term effects of Covid-19 in Catalonia. Joining me in the studio today is Cillian Shields. Hello, Cillian.
Hey, Beth. How are you?
It's great to see you.
Great to see you. Interesting topic. One that I suppose deserves reflection, even though it's a somewhat grim thing to be speaking about, but a huge moment in all of our lives, I guess.
Really necessary. Now, Cillian, you actually lived the lockdown in Barcelona. What memories do you have of that time?
Yeah, I mean, very different stages of it, I suppose, is the first thing that I think of. I mean, Barcelona and Catalonia had one of the strictest lockdowns. And then, of course, there was the phased reopening where we were allowed out in different age groups, actually, for a while and in different times. Then, of course, like bars and restaurants were only able to open for breakfasts and for lunches. And I can't believe it's been 5 years. Really amazing. This exact day, March 14th, 5 years ago, it was a Saturday. I was actually working that day on Catalan News. And I remember we were just all very, very eagerly awaiting Pedro Sánchez to speak, to announce what's going on. Like, it was a time of such confusion. And he eventually appeared 9 hours later than what he was originally scheduled to. And that's when he announced the lockdown. And I remember that was a long day of work with no idea what was going on.
Cillian, what was the first recorded case of COVID in Catalonia?
Yeah, so the first recorded case it happened a few weeks prior to the lockdown, obviously. And Catalonia had its first case. It was a woman who lived in Barcelona who had travelled to Italy, where there was a huge case, as you might recall, in northern Italy in the very early stages of 2020. And she then presented at Hospital Clinic with mild symptoms. And, well, this was the start of it all, really.
Yeah, I think in the lead up to the lockdown, I don't think anyone really realised how serious it was. And, of course, if Spain had gone into lockdown earlier, I think a lot of lives could have been saved.
Yeah, precisely. But of course, this is just part of the uncertainty, I think, made it so scary. This was this mystery disease that we didn't know how bad it was going to be, really. It's not the exact same how many lives could have been saved, but we do have figures for the increase in deaths that Catalonia saw in the entire year 2020. So that actually increased by more than 23%, which is a huge anomaly, kind of like statistically speaking. The registered deaths increased by more than 15,000. So it kind of puts some perspective on how serious this disease was, yeah.
Yes, and despite the vaccination campaigns, there do still continue to be cases of COVID in Catalonia.
Yeah, absolutely. I got it myself only a few months ago, actually.
Oh, gosh, I remember that.
I was very mild, though. I mean, it was completely fine. But, of course, like the WHO still classifies it as an ongoing global pandemic. But the thing is, obviously, very few people in the world actually live like we did 4 or 5 years ago. It's basically been relegated to the status of a flu, like just this seasonal illness that comes and goes, and maybe you'll get it, and maybe you'll be a little bit sick, but the world moves on.
And I think the fact that COVID-19 is no longer making the headlines is largely thanks to the vaccination of the general public. So to find out more, we spoke with Carmen Cabezas, who was the Catalan Public Health Secretary during the pandemic and who oversaw the vaccination campaign. She told Catalan News about the priorities and challenges of that time and how the virus was managed.
Carmen Cabezas was a senior member of Catalonia's public health agency when the pandemic hit, and she was in charge of leading the vaccination strategy that everybody hoped would lead us out of the gloomy depths of that time.
I think that the most important challenge related with the vaccination for COVID here in Catalonia was to vaccinate the most part of the population in a short period of time. At the very beginning, it was very important to vaccinate to all people living in the nursing homes, and that is difficult here because we have more than 1,000 nursing homes in all our territory, and it's important to go there and to vaccinate every person there and also the professionals that are taking care of the people living there. And that was difficult at the very beginning, in special because the vaccines are special because are multi-doses and also requires good manner of care. It was difficult to do this vaccination because it was not the same than in the normal vaccines. And after that, we have to vaccinate all the rest of the population, but in a strict order of priority, beginning for those people that is over 80, and after that over 70, and so on. And it's very important to adjust the quantity of vaccines that we dispose to the people that is of high priority in every moment. And we need to focus on that, and we need to work many different professionals. We have to teach and to train them because the different characteristics of the vaccines, and to apply them in a very strict way.
Cabezas was part of a team of health professionals that Catalonia became very familiar with as they appeared in weekly press conferences to explain the epidemiological situation to the population, who took in the news eagerly awaiting good progress to return to a more normal life that we now enjoy again.
The goal of our communication process was mainly to communicate the importance of the vaccination, the epidemiological data, and the results of the vaccination in our population. And we analyze every week the results, and we share with the population and with the media all our data. But we try to explain in a way that was understandable for the people. And we make big efforts, the Minister of Health and myself, to explain our data, our results, and how good are these results. Because, for instance, we look for the data in the nursing homes, and during the first 3 months, the mortality has decreased more than 90%, and was impressive. And that was very, very important also for our health professionals, because they feel very proud of their work.
With the benefit of 5 years of hindsight, looking back at a time of chaos and uncertainty, Cabezas is confident that the teams who managed the crisis did the best they could, given the unprecedented circumstances facing the world.
In 2020, we know nothing about this virus. It's a new virus, and we think, or they think, that it's similar to the flu. And now we have a much better information system, and we have improved also our human resources here. I don't know, I think it's important to make the best decisions with the knowledge that you have at this time, and I think that the people that made these decisions tried their best.
Thank you, Cillian, for bringing us that report. So, Cillian, how's the virus evolved over the past 5 years?
Well, this is really interesting. I mean, COVID-19, it doesn't show any clear seasonal pattern, the way that flu does, for example. It always reappears in the winter. So Catalonia has seen 7 major COVID waves, and the last of which came in the summer of 2022. And at the beginning of the pandemic, it was thought and it was hoped that COVID would be a seasonal virus. In fact, there was one study that was published in October 2021 by Nature Computational Science that explained that the spread of the virus is associated with low temperatures and humidity, very similar to the seasonal flu. But 3 years later, I mean, doctors and researchers say that it's still not possible to know whether or not it's seasonal. I mean, it's clearly shown that it's not seasonal, so I think that's wrong at that stage, especially because we've seen peaks in the summer as well. And during spring 2020, going into the summer, when Catalonia and the whole world was in a phase of kind of de-escalating the measures, it was really hoped that the warmer weather would kind of stop the spread of the coronavirus, at least until the autumn or winter. But in fact, that summer, cases just skyrocketed again in the hottest months.
I mean, that's possibly because people were socialising more and some of the social distancing measures had been relaxed.
More than likely, yeah. I mean, definitely. As well, like we were all just having spent 3 months without seeing any of our friends and families. Obviously, it was natural that everyone wanted to go out, blow off some steam, live a somewhat normal life again and see people. Of course, we weren't vaccinated, so we weren't prepared for, reinfection.
Recently, there was a ceremony at the hospital clinic, which is one of the biggest hospitals in Barcelona, to commemorate the 5-year anniversary of the first confirmed case of Covid-19 in Catalonia. There, the doctors who spoke to the media were full of praise for the frontline healthcare professionals during those first months.
Ha sigut una gran lliçó de gestió.
It was a great lesson in management. We saw that we are vulnerable as a society, but that we also have the capacity to organise ourselves. And when we work as a team, we can overcome great challenges.
Ens en podem sortir dels grans reptes.
That was Anthony Castells, Healthcare Director of Hospital Clinic. He believes that the healthcare system has been strengthened since the start of the pandemic, but that many outstanding issues remain, such as the lack of beds in social and health centres. We spoke with the current Public Health Secretary Esteve Fernández on the state of the Catalan public health system and found out how Catalonia is now better prepared to deal with possible future pandemics.
Esteve Fernández was promoted to the position of Catalonia's Public Health Secretary just last summer, taking over from Carmen Cabezas, who led the COVID vaccination strategy. Fernández was working in a hospital throughout the pandemic and now oversees the strengthening and further development of the Public Health Agency. I started by asking him what lessons has been learned from the COVID-19 pandemic and what he can take from that into his new role.
Always we have thought that we need to be prepared. But after COVID, it is very clear that we need to think about all the things that can happen, make all the scenarios a priori. This is very important. The other thing is the need of coordination. I believe that in the very beginning of the pandemic, there was some non-coordination, lack of coordination or suboptimal coordination would be the nice word. So, and I believe that this is very, very important. Not only among the health sector, but with all the other institutions involved, even outside the health system, because it was not a problem of the health system. It was a holistic problem, a systemic problem. And I believe that in the very beginning, here, at least in Catalan and also in Spain, there was some consensus of saying we have to work together, policy, different ministries, different departments, economy, transportation, etc., with health, to try to do the best things to address the different problems that were going on. Because, well, the management of the pandemic was complex and not only related to the assistance to the healthcare system. So, preparedness, very important, capacity of reaction without delays, quick decisions taken together by consensus, and with the politicians agreeing with the technical managers and researchers and so on. I believe that putting together these different sectors was one of the keys to go ahead with the control of the pandemic.
Mm-hmm. And with those factors in mind, now 5 years on, do you think Catalonia is in a better position to deal with a similar crisis now?
I do think, yeah. I believe that we are more prepared. Of course, that we are conscious about what happened and what can happen in the future. In fact, we have protocols. We are revising them. We talk with the other actors that can be taken. We are not thinking in a determined epidemic or a determined problem, but putting all the system ready to change and, the other word is to adapt to the situation. We cannot have 100 epidemiologists in a room waiting to be useful in case of an emergency. We have our personnel, our physicians, epidemiologists, nurses, etc., doing other things, but they can be mobilized in case the situation requires.
Thank you, Cillian, for that report. It's really reassuring to know that Catalonia has protocols in place should a similar situation arise. Now, many sufferers of COVID have made a full recovery, moved on and forgotten all about it. But for patients of long COVID, it's another story. Cillian, what can you tell me about this disease?
Well, I don't want to act like I know anything about it because not even doctors know much about it. Very, very generally speaking, it's people who've been infected with COVID but whose symptoms didn't take the what we all thought would be just 2 weeks in order to go away. In many cases, it's been weeks, months, or in some people's cases, even years. It's people feeling a lot of fatigue, a lot of headaches, sore throats. But the thing is, you asked me the question, what can you tell me about this disease? I can only speak in very, very general terms because it is a disease that the medical community, doctors themselves, do not have a clear grasp on. It's different for every different case, and they do not know how to cure it effectively. It's one of these long-lasting effects of the pandemic that is not very well understood at all.
But some people who've been trying their best to understand it are the doctors at the Germán Teresa i Pujol Hospital in Badalona. It's one of the leading medical centres in Catalonia, and they launched a pioneering long COVID unit in June 2020, and a similarly pioneering paediatric unit in December later the same year.
Yeah, absolutely. So far in these 4.5 years that it's been open, it's treated 2,000 people with long COVID, and remarkably, only 7.5% of those have actually been cured. Some people are still unwell today after falling ill all the way back in March 2020. The possibly good news on the horizon, though, is that in February, a clinical trial of a drug against long COVID began, and the first results from that are expected in 2026.
And as well as adults, the hospital also treats children.
Yeah, exactly. There's currently around 80 minors being treated for long COVID, but in the past few years, they've treated a total of nearly 200. Quite interestingly, the disease is a lot less frequent in children than in adults, and it also has a much higher recovery rate. However, the bad side is that doctors explained to the Catalan news agency that there are worse repercussions of long COVID for minors because the disease impacts the patient at a vital moment of development at all levels, such as their studies, their socialisation, even sports. This is going to have a much larger impact on an adolescent just growing up than it would on a fully formed adult.
Yes, you don't know how much damage has actually been done by the virus.
Yeah, precisely. And I think one thing that just overall, both in adults and in children, that really kind of marks long COVID is just the uncertainty of everything. Doctors say that many cases just resolve themselves spontaneously. They don't know what makes a patient recover or not. And even treatment just to make the effects lessened are different for different people. So it really is a bit of a mystery disease that has just arrived a few years ago with the arrival of COVID-19, and it's just hanging around in society now.
To find out more about long COVID, we spoke to Silvio Soler, spokesperson for the collective of people affected and persistently affected by COVID-19. Let's hear that interview.
Silvia Soler is the spokesperson for the collective of people suffering from long COVID. For her, the pandemic has never ended, and she doesn't see any possibility of things changing soon.
Vaig agafar la primera infecció al març del 2020.
I first got sick in March 2020, and I've been reinfected 8 times since. I still feel something, like I've never fully recovered. And I don't have any day where I see the light and think I'll be cured, and that I'll overcome it. My voice is still hoarse. I've got muscular problems, joint pain, tinnitus, sensitivity to sound, skin issues, intestinal problems, and a general level of fatigue that leaves me wiped out.
I la fatiga central que em deixa morta, és a dir, em deixa fosa.
She believes that people suffering like her have been abandoned by authorities.
El Covid persistent és una subpandèmia que no volen.
It's a problem of health, society, and labor. It affects the world on many different fronts. And it's a lot of money. But we are the people who at the start of the pandemic were told to stay at home, to look after ourselves alone. And now, 5 years later, we're sick. I think part of the responsibility falls on the governments and health authorities. They need to give us an answer.
Crec que una part de responsabilitat la tenen els governs i la tenen els organismes de salut, els organismes públics de salut o de treball, en donar-nos una resposta.
As for the health professionals, they can offer very little by way of answers.
És difícil, no? La incertesa.
It's difficult, the uncertainty, not being able to offer explanations to a patient why they're going through this, if they'll be cured or not.
That's Lourdes Mateu, director of the Long COVID unit at the Can Ruti Hospital in Badalona.
És important. Hi ha pacients que potser no s'han curat i no han tornat a la seva vida.
There are some patients who, even though they've been cured of the disease, haven't been able to return to their normal life from before. Instead, they're just adapting to their new condition. There are some patients who are cured after 2 or 3 years. Some patients have been cured but then have had the symptoms return to them. There's still so much we don't know.
S'han tornat a infectar. Encara ens falta molt per saber.
There is no one type of long COVID patient. Different people suffer with varying levels of different symptoms, and people of all ages can catch the condition too.
Jo cada cop anava pitjor, vull dir, ja no anava a l'institut, anava potser un dia o una hora si arribava.
I was getting worse and worse. I wasn't going to school anymore. I was maybe going for just one day or only an hour if I made it. I couldn't do homework. I spent the day sleeping. I had no alternative.
Laura Prats is now 22 years old, but she first caught COVID 5 years ago and has suffered greatly for years since.
Jo a casa tinc escales, 14 escales, que les vaig comptar en aquell moment.
I have stairs at home, 14 stairs. I counted them. And there was a time when it took me more than half an hour to climb 14 stairs. My legs were shaking. I lost almost 10 kilos in 3 weeks because I wasn't eating.
Being infected with such a debilitating dose of COVID had a huge impact on Laura at a pivotal moment of her life.
Però érem 17 anys de l'activitat, jo que tenia com la vida planificada.
I was 17 years old, finishing school. I had my life planned out, and it was like life suddenly stopped. I saw everyone around me continuing their normal life, but mine had to stop. This affected me a lot mentally.
Vaig perdre molta força, que de fet el tema de la força és un tema que s'ha quedat allà.
I lost a lot of strength. In fact, that's something that's still ongoing because I used to play basketball. Obviously, I stopped playing when I had COVID, and I haven't been able to get back to the level of fitness that I had before COVID.
Despite never recovering to the same physical condition, Laura managed to find a different kind of strength within herself.
Jo en el moment recordava que pensava, i jo ho segueixo pensant, que és molt injust.
At the time, I remember thinking that it was very unfair, but I mean, it is unfair, whoever gets it. But what I was thinking was, why me? I think I've learned a lot on a personal level to overcome it and say that I've been through something very hard. I've managed to overcome it. And it also helped me to clean up the circle I had around me. It was really good for me to see who my real friends were. And I think, above all, it gave me the strength to say that you can do anything you set your mind to.
We wish strength to everyone suffering from long COVID. Cillian, in what other ways has COVID changed society here in Catalonia?
Yeah, the pandemic has had a lot of very different effects. Especially the home confinement period definitely played with the mental health of a lot of people. So one major change in society that we've seen since the pandemic, and that has been reflected in a lot of data that our colleagues at the Catalan news agency have studied, is the higher prevalence of eating disorders, actually, particularly among young girls.
And of course, social media may also be playing a role in this.
Yeah, precisely. In so many cases, people were just stuck at home with very little else to do other than scroll on their feeds.
Of course, consuming toxic content, which is highly addictive, is certainly going to take its toll on people's well-being. And something else that's changed with the pandemic is our way of working.
Yeah, that's exactly, yeah. It became omnipresent, and it's still quite common to work remotely, to work from home in a lot of people's circumstances. For a long time, everybody who could was obliged to work from home, especially in the earlier stages of the pandemic. And 5 years on, it's stabilised as an option for around 17% of employees in Catalonia.
So we've seen that we can do it, and now we're not going back.
In a lot of cases, yeah.
It's clear that there are many long-term effects, and that, for better or for worse, COVID-19 is still very much present 5 years down the line. It's time now for our Catalan phrase of the week. Cillian, what do we have?
This week we've got val més curar-se en salut.
It's worth more to cure yourself in health.
Basically, more or less. I think an English equivalent would be prevention is better than the cure.
How appropriate.
Exactly, yeah.
And it emphasises the importance of taking care of your health and preventing problems before they arise.
Val més curarse en salud.
And it could also be applied to getting vaccinated during a pandemic. This week on Filling the Sink, we've been talking about the Covid-19 pandemic in Catalonia. Thank you to everyone who spoke with us. And of course, thank you to Killian Shields for joining me.
Thanks very much, Beth.
It's a pleasure. And that's all for today. Thank you for listening. Make sure to subscribe to Filling the Sink wherever you get your podcasts if you haven't done so already. We'll be back again next Saturday with another exciting episode of Filling the Sink. On behalf of all of the team here at Catalan News, I'm Beth Cohen, wishing you a great weekend. Fins aviat. Adeu.